Today we're diving into the topic of heart valve regurgitation. Ever wondered what makes a heart valve leak and why it matters?
Yeah, it's a fascinating yet serious condition. Basically, heart valve regurgitation means one of your heart valves isn't closing properly, so some blood leaks backward. That can really mess with the heart's efficiency.
Right? And most people might not even notice at first. The heart's pretty good at compensating, but over time, that extra workload can wear it down.
Exactly. Sometimes people only find out when they start feeling symptoms like shortness of breath or fatigue. It can sneak up on you.
I've heard there are different types of regurgitation depending on which valve is involved. Mitral regurgitation is the most common, isn't it?
Yes, mitral regurgitation is the most frequently diagnosed, but it can also happen in the aortic, tricuspid, or pulmonary valves. Each one affects the heart a bit differently.
Speaking of causes, what usually leads to a leaky valve? Is it always something you're born with?
Not always. Some people have congenital defects, but others develop regurgitation from infections like endocarditis or after a heart attack. Even age-related changes can weaken the valves.
That's interesting. So lifestyle can play a role in prevention to some extent, right? Like managing infections or heart disease risk factors.
Absolutely. Taking care of blood pressure, cholesterol, and avoiding infections goes a long way. But sometimes it's just bad luck with genetics or aging.
When it comes to symptoms, you mentioned shortness of breath and fatigue. What else should people look out for?
Swelling in the ankles or feet, irregular heartbeat, or a persistent cough, especially when lying down. Some people experience chest pain, though that's less common.
I imagine that makes it tricky to diagnose, since those symptoms overlap with other heart problems.
Definitely. Doctors often use echocardiograms, which are ultrasounds of the heart, to spot regurgitation. They can see the blood flow and valve movement in real time.
That must feel like looking under the hood of a car. Sometimes you need that visual to really understand what's going wrong.
That's a great analogy. And just like a mechanic, cardiologists can often spot the problem early, before it causes bigger issues.
But is it always necessary to treat regurgitation right away, or can you just monitor it?
It depends on the severity. Mild cases might just need regular checkups, but if it's severe or starts causing symptoms, treatment could be necessary.
And treatment options range from medication to surgery, right?
Yes, medications like diuretics or beta blockers can help manage symptoms. But if the valve is really leaky, surgery to repair or replace it might be recommended.
Surgery sounds intimidating. Is minimally invasive surgery an option for heart valves these days?
For some people, yes. There are catheter-based procedures now, like the mitral clip for mitral regurgitation, which don't require open-heart surgery.
That's amazing. Medical technology has come a long way. I bet recovery time is much faster with those less invasive procedures.
Usually, yes, though not everyone is a candidate. It depends on the person's overall health and the specifics of their valve problem.
So, for listeners who might be at risk, what should they focus on to stay healthy?
Regular checkups are key, especially if you have risk factors. And don't ignore symptoms like unexplained fatigue or swelling. Get them checked out.
I guess it really comes down to listening to your body and maybe not blaming everything on just getting older.
Exactly. Sometimes what seems like aging is actually a fixable issue, and early detection makes a huge difference.
If someone does get diagnosed with heart valve regurgitation, what's life like for them? Is it possible to live normally?
For many, yes. With the right treatment and monitoring, people often live full, active lives. But it does mean keeping up with medical appointments and sometimes making lifestyle changes.
Like watching your salt intake, staying active, and managing stress? The basics of heart health still apply, I'd imagine.
Absolutely. It's not about running marathons, unless you want to, but keeping your heart in good shape is always important.
I love that. You don't have to outrun your problems. Just walk briskly past them.
That's a good motto. And don't forget, support groups and counseling can help too, especially if people feel anxious about their diagnosis.
Heart issues can be scary, but knowledge is half the battle. The more you know, the less daunting it feels.
Well said. And there's so much support available now, from cardiac rehab programs to online communities.
Before we wrap up, is there any new research on heart valve regurgitation that listeners should know about?
There's ongoing work on better imaging and new valve repair techniques. Researchers are also working on ways to predict who's at risk earlier, so intervention can happen sooner.
That's encouraging. The future looks promising for anyone dealing with this condition.
Definitely. The main takeaway: don't ignore your symptoms and don't hesitate to ask your doctor questions.
Absolutely. Thanks for exploring heart valve regurgitation with me today. Hopefully we've helped demystify it a bit.
I hope so too. And maybe next time we'll talk about another heart topic. There's always more to learn.
For now, take care of your heart, and remember, a little awareness goes a long way.
See you next time.